All right, hi, my name is Janet Gonzalez and I'm a registered nurse. I will be assessing my patient today. This is Miss McCartney. We will be assessing her abdomen and flank area. So most importantly is the draping of the patient, making sure that the only area exposed is the area that I'll be working on, so which it is, every other area is covered. So we will start by inspecting after I wash my hands. All right, so ready for inspection. So some of the things that I'm going to be looking for here are the contour of the abdomen. In my case, it is flat, which is good. I'll be looking to see if there are any bulges or masses, any lesions, any pulsations. So let me try to identify if there are any masses or growths. So what I'm going to do is just stand behind her, and Miss McCartney, if you can just take a deep breath in and out for me, please. Perfect, I don't see any. And then if you can just raise your head up a little bit and breathe normal. Okay, looks good. So everything is within normal limits on this inspection part. So next I will auscultate. So I will auscultate in a systematic formation. So I will start at my patient's right lower quadrant and I will work my way around. And I am basically I'm trying to identify that there are bowel sounds in all 4 quadrants and that there is peristalsis going on. So I will start. So you'll feel my cold stethoscope. Sorry if it's not warm. All right, so I did hear bowel sounds in all 4 quadrants. I am going to listen over her liver and spleen, make sure there aren't any friction rubs. Okay, and next I'm going to turn my stethoscope over to the bell side, and I will listen to her aorta, make sure there aren't any breweries. And renal arteries. Okay, all sounds good. So next we will move to the percussion part of the exam. So I will go ahead again, work my way systematically. So you're just gonna feel my fingers on your abdomen, Miss McCartney, and I'll go ahead and start again at the right lower. Perfect, and what I'm trying to listen for here is basically tympany over the organs that have air in them, for example, the stomach or the intestine, and then dullness over the, for example, the liver or the spleen, so solid organs. Let me just percuss over the liver, spleen. Okay, perfect. So I am going to identify the liver border now. So it's basically at the right mid-clavicular line of the patient. So I'm going to start from lower to upper. And basically I have to stop when I hear dullness. Okay, so right about here, I'll move my way from upper to lower now. So, and it should measure 6 to 12 centimeters. So in my case, it is about 6 to 12 centimeters. Okay, so moving on, we will go to the palpate So I will again work my way around the same order. So I'll do light palpation first. Let me know if you feel any pain or discomfort anywhere. Okay, and I'll just use one hand. Any pain or discomfort?
No.
Okay, so now I will do deep palpation. So I'll do double. Again, let me know if you feel pain or discomfort. Anything. Okay, so this is mainly used to determine mass and any masses or lumps underneath. So in her case, she seems to be within normal limits. So I'm gonna palpate the liver next. And so what I'm gonna do is put a hand underneath you here, Ms. McCartney, and I'm gonna feel for your liver. If you can take a deep breath in and out for me. All right, and again for your spleen. Okay, so the spleen, the liver, you can feel the border. The spleen, you don't want to be able to feel, because if you do feel it, then that means that it is enlarged and it is abnormal. In her case, I did not feel it, so we're doing good. Next, I'm gonna palpate her kidneys. So I'm gonna just place my hand again under here, Ms. McCartney, and if you can take a deep breath in and out. Okay, and the other one again. Out. Okay, so kidneys again, the right one you don't want to be able to feel at all. Left one you can feel if the patient is slender, which she is. I could feel a little bit, but the right one I did not. So again, everything is good. I'm going to palpate the aorta here. Okay, and I felt pulsations, so it's good. All right, perfect. So next I'm going to have you sit up a little bit. And I'm gonna raise your shirt a little bit here. All right. And I am going to do the costovertebral angle percussion. And this is just to identify if there's any tenderness on her kidney area. So let me know if you feel any discomfort, Ms. McCartney. Okay. Any pain? Okay, perfect. And this concludes my assessment. Thank you for watching.